This is Mary Jo. Mary Jo and I have been working together for years, actually. We started working at Texas Health with the Northwest Independent School District, and that's when we started working together, and that's when I started learning what Mary Jo is all about. So I really want you to know about Mary Jo, because she is the other provider in our clinic. And if it wasn't for her, we wouldn't be able to do this. Because if you haven't looked at my website, you'll realize that I have a disability and I can't see loads and loads and loads of patients. It's not that I want Mary Jo to see loads and loads of patients, because our goal is to make sure that you're getting proper care, which means that although Mary Jo will see you a lot of the times, I will be around in the room listening to your story and helping her as much as she needs help, which is not that much. Actually, she's pretty on track with my philosophy in medicine, but also helping. We work together and use our brains to figure out what we can do to make your life better. So, Mary Jo, why don't you tell them about yourself? I don't want to.
Okay, well, I'm a family nurse practitioner and I've been in the business quite a while. My background as a nurse, as an RN, started on a medical floor. Then I went to ICU. I did telemetry. I did long-term care, where we took care of patients that were on ventilators for a long time, sometimes months, and wound care, which that takes weeks and weeks. And I also did house supervisor at 2 different hospitals, and that was interesting and fun. As a nurse practitioner, I started in a family practice clinic, and so we took care of patients like any family practice clinic. Most of the time it's from age 2 till whenever. I think the oldest person I ever taken care of was 100. So, have you ever taken care of anybody?
Yeah.
Over 100?
Not much, but a couple.
Yeah.
A couple.
So
in residency.
There's a few. So basically, from birth to death, we'll see that group of patients. And I was going to say, one of the jobs I did was workers' comp. And in workers' comp, we also did travel medicine. And just a little caveat. So that's been probably 15, 20 years ago. And yes, we ordered ivermectin and HCQ. Those drugs have been around.
Uh-oh.
Well, HCQ has been around since about 1955. And ivermectin started with animals.
Hydrochloroquine, by the way, that's HCQ.
Okay. And ivermectin started in the animal field in the 70s, and then it became human consumption in about 1987. So those drugs have been around a long time. And I ordered them all the time, never had any issues with them, ever.
You know, there's a great link that I just saw yesterday. I'm going to put a link on after this video so you can see what a pharmacist talking about the same thing. So I will put that, I think I'm going to put that link on there. It's pretty interesting, talking about a lot of different compounded medicines. We do that here in our clinic. We don't compound ourselves, but we do have a really great compounding pharmacist to help us with some things that can also do, you know, some extra stuff for you guys that some clinics don't offer. So, what was your favorite part? I mean, you ended up in family medicine. So how did that?
I don't know. Everything I did, I really enjoyed. Because, you know, I went from family practice to travel medicine, total different worlds. Mm-hmm. But every place I went was so enjoyable. I loved the long-term care facility. We got to know those families, and they became our family. And when they died, we cried right along with them. I mean, we got so attached to those people.
Yeah.
So I don't know. Everything I've done, I've really, really enjoyed. And along the way, you meet, different providers and support staff, and they've become friends. And
Sounds like you like the
patients.
people.
I do.
I think it's the people. That's what I like about it.
Well,
I think that's the issue.
everybody has such a cool story, and you can never make this stuff up when people tell their own story. So I like to hear what they say. So God has given us 2 ears and 1 mouth. What does it say? Listen more, talk less, right?
Right.
So you listen to the people, they will tell their story, and a lot of times they know what needs to be done. They just need verification.
That is true. That is so true. And that's like one of the things that I was taught in medical school is if you have a patient and you sit down and listen to them, they'll tell you what they have, and they'll tell you what they need. They may not know what they need, but when they start talking, it's like, I know what they need. I hear what they say, and I realize what's going on. But gosh, if I don't listen,
So true.
I don't know anything, do I? I just know what I think. That doesn't help you. So that's why I opened this practice in the first place, was because I wanted to have a way to have my own autonomy and give Mary Jo autonomy as well to look at a patient, see what's going on, and make a decision and spend the time rather than having patients shoveled in just one after another without the time. That was the biggest issue, I think, in working in the corporate medicine. Although, look, they were good people, working with them, but there was you've got to see lots of patients. You've got to see lots of patients, lots and lots of patients, because medicine became a business, not an art. And medicine is an art. Medicine is everybody's different. It's just like looking at a palette, and you've got to figure out what colors or what medications or what supplements or what kind of activity, what needs to be done. And when you're working with that patient, that's the piece of art that you have to work with. And you want to make it the best that you can. So with the patient, you want their blood sugars to be the best that they can be. You want their weight to be the best that it could be. You want everything as good as it could be. And so we want to be able to spend that time and do the extra things, some things that, may end up costing cash. But it's good medicine and real medicine, instead of, here, just take this pill for the rest of your life, and now you have a side effect and you're still not better, so here's another pill to take. And that's not the right direction. That's not the direction that we want to go.
Well, yeah, we try, of course we need medicines, but if we get to the root of the problem, you might not need the medicine.
Exactly. And so the root of the problem can be eat more vegetables.
Gut health is very important. We're really seeing that now.
Extremely that. Gut health has gone, I don't know how to even describe. It's just gone into the dirt. It needs dirt probably, but gut health has created so much inflammation in the entire body that inflammation itself creates heart disease.
It affects all.
It
your
affects
organs.
how you digest, how you take in the different vitamins and things that you need to help your metabolism work. And when your metabolism doesn't work, guess what happens? You gain weight, you feel crummy, you can't get out of bed, you don't want to get out of bed, you get depressed. All the medical problems happen as a result of this inflammation. So we've learned that I've learned just through, just studying, it's like this inflammation is what we really need to start working with. And not with steroids, because that is not the way. The way to fix it is to fix
the root
problem, which usually turns out to be gut problems. But notwithstanding, if a person comes in and their blood pressure is too high, we can't just go, let's solve your gut problem while you have a heart attack. So that's not going to happen. We're going to give you blood pressure medicine. We're
going to
going to
treat
get
you.
you stable. And then we're going to say, hey, do you want to get better than this, or do you want to go down this route? And it's a choice. Hey, if I only had 2 years to live, I might sit there and say, you know, I'll just take the medicine because treating the gut health takes effort and costs money, and I don't want to spend it. I would like to take an opportunity to publicly thank the people that have helped bring this into being, because I don't have the endurance to do it. I can sign papers and I can go in and talk to people, and I can maybe see a few patients in a day alone, but I have people that have put this together, and that includes my husband that we talked about. Don't ask him any medical questions, please. He's an engineer, okay? And then Hung, he is a jack of all trades, but he is not medically trained any more than what we've trained him, and that is he can take blood pressure. He does stuff like medical assistant work right now until we get busier, and then we'll get a medical assistant to come and work here. So he's learning to do a lot of things, and he's really fast. In fact, he put this stuff for the video together. I'll be editing. But in any case, these guys have organized everything. They've made phone calls. They've acquired furniture. They've basically done a lot of stuff to put things together. And Mary Jo has been sitting here on hold waiting for 4 years, almost 5 years.
Well, I think it's like 3.
Okay.
3 years.
She's been like just on the in the background for in case things get crazy, because if something goes crazy, if we get crazy busy, I might even have to get another nurse practitioner, because I can walk into a room and listen, and I can use my brain, but I can't do all the work that's involved in the physical exam. Fortunately, I have people that can, and that's how we're working things here. And so thank you to Steve, thank you to Hung, thank you to Mary Jo. And if you know someone who's looking for a doctor, if you have a doctor you love, keep them. I'm not asking you to, but if you know someone who needs a doctor, or you need a doctor, you haven't seen anybody, you're afraid to go because you don't want to be yelled at because of your weight, your blood pressure, et cetera, et cetera, et cetera. Ain't gonna happen here. No way. So if you need a physician, you're in the DFW area, close to Keller, you're willing to drive in to come in and see us, please do, so we can help you figure out what you need to do for your best health.
Great.